Most of my mom's family has HAE, so it wasn't a surprise when I was diagnosed with it when I was 3. I started having my first attacks when I was in middle school. I wasn't on any kind of treatment at that time, so there was really nothing I could do about it. I just had to grin and bear it. If there was a swell on my face, I just hope it wouldn't get to my throat. When I had an abdominal swell, I'd be in bed for like 3 days waiting for the pain to go away. It wasn't easy going through life like that. As I got older, I was having about 3 to 4 attacks a month, which meant missing days at work. Holding down a job wasn't easy, and it wasn't easy explaining to people why I was out all the time. It was even harder listening to them explain to me that I just had allergies and I should try this solution or that treatment. So I'd often avoid the conversation altogether. At some point, I had a swell that spread to multiple parts of my body, and it put me in the hospital for an entire week. It really showed everyone, including me, just what this condition could do. Shortly after TAKHZYRO was approved, I talked to my doctor about it. He told me it was a preventive treatment that could give me fewer and less severe HAE attacks. He also mentioned the dosing schedule. Doing a subcutaneous injection every 2 weeks felt manageable. We talked about potential risks, serious side effects including allergic reactions, and some of the most common side effects like injection site reactions, upper respiratory infections, and headaches. At the end of the day, I decided to give TAKHZYRO a try. After about 3 months of treatment, my attack rate had gone down significantly. I've even gone several months in a row with 0 attacks. But after a while, I decided to enroll in a trial for a new treatment. I guess I thought maybe I could do better. Turns out I was wrong. This treatment ended up just not being right for me. So I called my doctor and said I wanted to return to TAKHZYRO. TAKHZYRO offered me fewer and less severe HAE attacks than before I started on a preventive treatment. I also thought the duration of the treatment between doses was very appealing. I could take my TAKHZYRO and not think about injecting it for 2 weeks. I feel good knowing that TAKHZYRO is a treatment I have been able to rely on, and I continue to do so.
What is TAKHZYRO? TAKHZYRO, lanadelumab, is a prescription medicine used to prevent attacks of hereditary angioedema, HAE, in people 2 years of age and older. It is not known if TAKHZYRO is safe and effective in children under 2 years of age. Important safety information. TAKHZYRO may cause serious side effects, including allergic reactions. Call your healthcare provider or get emergency help right away if you have any of the following symptoms: wheezing, difficulty breathing, chest tightness, fast heartbeat, faintness, rash, hives. The most common side effects seen with TAKHZYRO were injection site reactions, pain, redness, and bruising, upper respiratory infection, headache, rash, dizziness, diarrhea, and muscle aches. These are not all the possible side effects of TAKHZYRO. For more information, ask your healthcare provider or pharmacist. You may report side effects to FDA at 1-800-FDA-1088. TAKHZYRO has not been studied in pregnant or breastfeeding women. Talk to your healthcare provider about the risk of taking TAKHZYRO if you are pregnant, plan to be pregnant, are breastfeeding, or plan to breastfeed. Please see full prescribing information, including information for patients, at TAKHZYRO.com.